This is tachyarrhythmic activity going on. Right? Now, you have given a drug. You have to tell me which drug has been given. What is this? Calcium channel or sodium channel blocker? Is that right? Now, what is this? Hyperpolarized and slope is also reduced. What drug has been given? Yes? Acetylcholine, and acetylcholine is usually not given as a drug. Vagal stimulation is there for SN node, AV node or adenosine. Simply, the slope has been reduced. Do you mean the resting minimum potential is normal? What is this? Threshold potential is normal. Simply, slope has been reduced. What is this? Beta blockers. Am I clear? Now you can understand how sodium channel blockers or calcium channel blockers or beta blockers or adenosine and acetylcholine, all of them, by using different mechanisms, how they can reduce the tachyarrhythmias which are produced by abnormal spontaneous automaticity by SN node or AV node or by Purkinje fibers. For Purkinje fibers to reduce their activity, one more mechanism is used. What is that mechanism? I will explain it. The one more mechanism which is used, resting minimum potential and threshold. Purkinje cell. Am I clear? Now, let's suppose if I use a drug which does not allow the potassium to efflux. This activity is going normal. Only thing is that, this is repolarizing current in phase 3. This was phase 0, phase 1, 2, 3 and phase 4. Right? During this phase, membrane is rapidly repolarizing. Why it is repolarizing? Due to heavy potassium efflux. And this potassium efflux is by voltage gated potassium channels. If you give a drug which is blocking voltage gated potassium channels, then can potassium go easily out of the cell? So potassium efflux from the cell is reduced. Which potassium efflux? Repolarizing voltage gated potassium efflux. Repolarizing current of potassium is reduced. So it will take longer time to repolarize. Even if slope and other things are same, so total number of action potentials will be reduced. Is that right? So what we have done in this case, that we have increased the, in this strategy, increased the duration of action potential by using which type of drugs? Potassium channel blockers. Yeah.
Doesn't that cause arrhythmias as well?
Yeah, potassium channel blockers increase the chances of torsades de pointes. You remember that, because they will increase the repolarization. But if you give in toxic doses, and that is one of the toxic effects of the potassium channel blocker, one of the very important toxic effect of the potassium channel blocker, that they precipitate torsades de pointes. Am I clear? Yes, please. That's number 5. Okay, actually truly mechanisms of 4, combinations may become 5. Listen, one mechanism, okay, let me tell you. One mechanism is, look here, what was this? Elevate the threshold. Second mechanism, okay, just to understand it easy, is, I'm making in a different way now. It is not according to this. One way to prevent the tachyarrhythmia is increase the threshold. Other way is to decrease the, hyperpolarize the cell. Third way was decrease the slope. Fourth way was prolong this, or any combination of these actions. Am I clear? No problem up to this? Just test. If you have given sodium or calcium channel blocker, slope will reduce. How many drugs are reducing slope now? Sodium channel blocker reduce the slope, calcium channel blockers reduce the slope, beta blockers reduce the slope. Which drug elevates the threshold? Sodium channel blockers elevate the threshold in Purkinje cells, and calcium channel blocker elevate the threshold potential for SA node and AV node. Which drug hyperpolarize the cell? Adenosine and vagal stimulation. Right? Which drug prolong the action potential duration? Potassium channel blockers. Of course, they increase the refractory period also. Am I clear? Let's have a break now.